Dr. Bill Adams here, and we've got a great show for you today. We're talking about an Australian report talking about fake plastic surgery and patients are suffering. So this is a very, I think, well done story. I enjoyed reading it and watching the video. They're hardcore. Our colleagues in Australia are hardcore. It's about cosmetic surgeons, people that have not had proper training or the similar training that most people would expect of their surgeon. So Jason, lead us off on this whole thing. We've talked about this before, but it's a little bit different spin, and it's from another country.
Right. So, it's funny because I watched the video, and if it wasn't for the Australian accents, I thought they would be in Miami.
Right.
Just a little different accent,
Right.
because we got this 50 miles from here, the same stuff going on. Now at least it's kind of metastasized to another country right now. It's the same thing we've been going through in the U.S. for a while with illegal places doing illegal things because people think they're getting something cheaper or that they can't get. So they're having the same problems we are. Although I would say watching the video was interesting. If it was the U.S., they would have closed down those places much more rapidly than they did in Australia.
The storefront originally, they showed a picture. It looked very professional. So it's, you'd have to be really in the know to figure out that. At least on the front of it, it looked very legitimate.
Well, I just have a couple of comments quickly. The corporate practice of medicine is very easy to unwind. So if you create a corporation, call it XYZ Corporation, open up in a strip mall and hire a vet to inject Botox into patients and do all the things, Bill, you said, which is to make the front end look and feel legitimate, you get caught. There are very few consequences. In most states, the practice of medicine without a license is like a $500 fine. I would imagine in Australia it's similar. It's not like, prison time. You don't go to jail for practicing medicine without a license. And the corporation just dissolves. It's an LLC. So nobody gets hurt in the long run except the patient. And then they pop up again in another strip mall. Jason, that's the problem we see with all the deaths in Florida with these boutique clinics. They just reopen up. So I don't agree that they crack down in the United States. It's really hard to crack down on these non-physicians. The physician is the only one who's really liable because they have a conscience and they have licenses that they have to hold. But corporations can just change the name and start again.
But these are like non-doctors and they're not under the same sort of requirements that we are. And that's what becomes the real problem. So I think the government ultimately has to step in at some point in time. I think they need to step in for a long, long time, even as it relates to physicians, because really all you need in most states is a license to practice medicine. And really you need no credentials in that particular specialty, especially in plastic surgery, to go ahead and hang your shingle and actually do these procedures with really no training, and which is very harmful. The problem is that, the minute we start talking about this, it looks like we're having like a turf war, that we're worried about people are invading our space. What we're really worried about is patient care and patient safety. We spent many years to assure that we're highly qualified to do these procedures. And the worst scenario is somebody with no medical training, but almost as bad as somebody with some legitimate training so they can at least put a degree that they're an MD on the door, but they actually have absolutely no training in the specialty, and they can cause as much harm as well too. So I think the problem isn't just in these types of pop-up clinics, but also in the ability for people to practice medicine outside of anything they've ever been trained in, and that can be very dangerous to patients.
Yeah, Bruce, I'm going to play the devil's advocate, and then I want you to respond. So, what if I said, okay, look, if this guy's a physician, he's an ER physician or he's an OBGYN, maybe they didn't train for years in doing surgery, but they go to a weekend course, they learn how to do the procedure, they're a physician, they're very smart, they passed all their things in medical school, they should be allowed to do this. Don't you think?
Part of it depends on what we're talking about. I mean, if we're talking about injection of Botox, maybe even fillers, that's one thing. But then when you get into liposuction, augmentations and so forth, it's where do you draw the line? And I think, in all honesty, for the government to get into trying to delineate who is properly trained and accredited is a real sticky wicket. And I think there's going to be problems because, it's the same kind of thing we fought with the American Academy of Cosmetic Surgery. And they say they're the real cosmetic surgeons. We're just reconstructive folks. And the government's going to have a hard time with that. There's going to be a lot of legal challenges. Here's what I think about this. I think this is an example of where, like this story in the media there, and we need more of this here. This is where some of the reality TV shows and things could actually do some really good for patient education. If you could show patients that just because it's cheaper and it's easy and whatever, you could get into a lot of trouble, that might actually serve to deter people and maybe encourage them to look a little more carefully at who they're going to for their procedures.
All right, well, listen, hey, those are some great insights. If you want to see more of these, you can see that on theplasticsurgerychannel.com.